Balikan natin ang unang kaso sa Pilipinas ng isa sa pinakabagong Omicron subvariant na BA.2.12. Gaano nga ba ito kabilis makahawa? Alamin natin mula kay infectious diseases expert Dr. Rontgene Solante. Magandang gabi po sa inyo, Dr. Solante. Well, let's begin with this. No, we're only starting yung second booster shot for mga immunocompromised. How soon should the rest of the population get it?
Well, yeah, our priority now is not the second booster. The second booster is only for the highly vulnerable population, the immunocompromised. What is important now is the first booster for the general population because, as we know in the data, Omicron really affected the protection against these vaccines or the protection of vaccines against this Omicron variant. And that's why if we will be having booster doses, the first booster doses for the population, we may have a good immunity and even with this variants of concern.
So according to the data, doctor, yung take-up ng first booster mababa pa rin. Why is that so? Because if we've we've had the first 2 doses already, bakit parang ano po ba nangyayari, ayon ng mga tao or what's going on, no? And why, how can we push that para we don't have another big problem on our hands?
Maraming factors, Pia. One is that they think they're already protected with a primary vaccine because cases are going down. Second, there is some complacency that this Omicron is only causing mild infection and you are not hospitalized, so naging kampante, no? And other factors there, yung adverse event nilang naramdaman ng first primary vaccine series, parang ayaw na nilang maulit. So these are all important factors na we continue to be promoting the booster, educating them. The importance of first booster will always be the protection against the severe disease. And if in case there will be variants of concern, like that what we have now in the Philippines, the BA.2.12, which is also as transmissible as that of the BA.2, because this is a descendant of the BA.2 and can also evade the immunity brought about by vaccine. But these are the scenario now. We can have a possibility of cases because of waning immunity or the low booster uptake or because of these super spreader events.
So Dr. Solante, in a way, itong the confirmation today that the first case is already here or already left, no, dahil finished national. This should push people, or, for lack of a better word, alarm people to take the first booster shot, right?
Right. I just want to emphasize this. No? The dominant variant here in the Philippines is the BA.2. And if we continue to have this BA.2, although smaller cases, there's a possibility that mutations will also occur here. And just like what other countries experience, like India and South Africa, because of low booster uptake and waning immunity, plus the fact the super spreader event, then that's a possibility that cases will also be going up.
Octa research is saying we could be looking at over 100,000 cases because of this latest development. And like you keep repeating, in super spreader events, we have all these rallies going on. We have Election Day, May 9. What should we do, doctor?
We should continue to wear our face mask, and as much as possible, if we can evade such super spreader event, then we have to. For those highly vulnerable population, as much as possible, we discourage them attending these events and continue to advocate and emphasize the importance of booster doses.
Okay, but you're saying na kung hindi naman immunocompromised, pwedeng mag-attend pa rin. Because the rallies are continuing. For example, a meeting de avance is planned on Saturday by the Lenny Kiko tandem. And that is something that people might be flocking to. So you're just saying that yung mga immunocompromised na ang dapat hindi mag-attend, and yung mga mag-attend kailangan nakamask and all the other health.
And I hope they will also encourage the politicians should also encourage getting their members getting the booster, no? Because I think that will have a very good immunity for those who will be attending these rallies.
And Doctor, one last question. Are we going to see a repeat of what we saw in January, where we had that Omicron surge, many households on lockdown? And, is it going to be as mild? Maybe I should qualify that. No, we're not sure about mildness. Pero ganyan din po ba yung magiging experience?
The ability of this virus being highly transmissible, it's a possibility we will have higher number of cases. But again, in terms of overwhelming the healthcare utilization or the healthcare capacity, I don't see that part of the pandemic causing this, because this will just be a less severe form of the virus.
All right. And of course, the most important takeaway in this interview, and para sa ating mga viewers, no, like Dr. Solante was saying, magpa-booster na kayo kung hindi pa kayo nagpapa-booster. Dr. Rontgene Solante, sir, thank you so much for being with us tonight.